Hello, this is Dr. David Green, Education Director for Pacific Bay Recovery in San Diego. Today's topic is private drug rehab for physicians and medical providers. Let's look at the scope of the problem. Over 10,000 people in the U.S. abuse prescription medications for the first time every day. Drug abuse knows no socioeconomic boundaries. Both blue and white-collar individuals are susceptible. Over 100,000 doctors, nurses, med techs, and aides abuse prescription drugs in any given year. Usually it's narcotic medication, so it's obvious that the medical community is not immune to the epidemic of drug abuse and addiction. Statistics show that only 1 in 5 medical providers with an abuse problem receives the necessary treatment. Reasons medical providers abuse drugs may include stress at work or at home, such as during residency, blowing off steam. It may occur after a legitimate injury, a surgery or a trauma that's undergone, and then you have a need for opiates, but then you're just unable to get off of them. And a lot of it comes down to simply increased knowledge and access. In the initial stages, the drugs and/or alcohol may relieve anxiety and fear. Usually the provider makes enough money to keep up with the addiction, and doctors are high-functioning individuals who feel like, I can handle this, I can beat it myself. When the idea of rehab comes up in their head, initially it's a combination of shame, fear, and denial. In reality, though, medical professionals are no better equipped to overcome addiction than the rest of the population. Dependence eventually turns into a chemical imbalance, which does need professional help, and once that's realized, it helps objectify the problem and makes medical professionals less ashamed. Treatment can truly be private. Physicians who find themselves mired in addiction can seek confidential treatment. The first reason is because of HIPAA. We all know that protects medical records. And the second is that records for patients undergoing treatment for substance abuse are protected under Title 42 in the Code of Federal Regulations. Pacific Bay Recovery is both private and comprehensive. The steps involved include an extensive intake process, along with detox, and then inpatient rehab and outpatient recovery. Our private rehab center offers both inpatient and outpatient treatments for the highest success rates, which are over double the national average. The long-term success rates for medical providers at Pacific Bay Recovery exceeds 90%. You can remain anonymous, and our center takes care of all the necessary arrangements. Call us today for more information at 858-263-9700 and visit us online at pacificbayrecovery.com.